Thank you, Chairwoman Harshberger and Ranking Member DeJed. Members of the committee, thank you for the opportunity to appear before you today to discuss the President's fiscal year 2027 budget request. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policies, captured agencies, and profit-driven systems caused it. Parents across the country demanded change, and we are delivering it. We are ending the era of federal policies that fueled this chronic disease epidemic and replacing them with policies that put the health of Americans first. President Trump and I are challenging the status quo and the institutions that defend it as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated a most favored nation drug prices with 16 of the largest pharmaceutical companies so that Americans no longer pay more than people in other wealthy countries for the same medications. We are bringing real transparency to healthcare pricing so that patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table to reform prior authorization. We are cutting red tape, speeding decisions, and demanding transparency. We're also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down. We sent a clear message to Americans: eat real food. HHS has opened the door to partnerships with industry, trade associations, nonprofits, and advocacy groups. More than 50 medical schools have committed to expand nutrition education from an average of 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry is committed to phase out petroleum dyes by the end of the year, and many have already eliminated them. In conjunction with these efforts, FDA approved 6 natural food colorings derived from fruits and vegetables. Through President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families and driving faster access to life-saving treatments. We are restoring gold standard science and integrity across the agency for the first time in decades. We are protecting children from sex-rejecting procedures that expose them to irreversible harm. We're eliminating outdated and misleading warning labels on hormone therapies used to treat women during menopause. We're strengthening oversight of organ procurement. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. I convened the 405 largest tech companies to agree to stop information blocking so that for the first time, every American is going to be able to access their own health records on their cell phones. We're implementing Operation Stork Speed to improve baby formula. We're applying that same focus and urgency to rural America. Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history, $50 billion over 5 years to strengthen rural hospitals and ensure Americans can access the care they need no matter where they live. Members of Congress on both sides of the aisle have made rural health a clear priority in their conversations with me because every state is feeling the strain of hospital closures and workforce shortages and gaps in access. HHS announced more than $135 million investment this month to expand rural residency programs and nutrition service. The data is clear. When physicians train in rural communities, they are far more likely to stay and serve there. The president's budget puts all these priorities into action. It invests in prevention because preventing disease costs less than curing it. As my uncle, President John F. Kennedy said, progress is a nice word. A change is its motivator, and change has its enemies. We see those forces clearly. Defenders of failing status quo, institutions that put profits ahead of the American people. That resistance underscores the urgency of this moment. We can reverse chronic disease, improve public health, and lower costs. I stand ready to work with Congress and this committee to seize this opportunity to implement and codify lasting generational reform in American healthcare for our country, for our children, and for the health of the American people. Together, we can make America healthy again.
Robert F. Kennedy cares more about human beings and health than anybody. I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines. And he's going to help make America healthy again.
The story of Kennedy and Trump has changed the course of history forever. August 23, 2024 will forever be known as the day we turned the corner and took back our great nation and changed the course of history and brought hope to a free world. Join me as we relive the strange relationship between Kennedy and Trump, leading to their return to the White House to make America healthy and great again. I spent 2 years following the Kennedy and Trump campaigns. Long before the two men ever considered running for president, Kennedy sued Trump and stopped him from building a golf course near the Hudson River. After Trump won the presidency in 2016, he recruited Kennedy to look into vaccine safety issues. Kennedy was forced out the door after clashing with a man by the name of Anthony Fauci. But the assassination attempt on President Trump's life brought Kennedy and Trump closer than ever. From rivals to collaborators, from foes to friends, this is the story of Kennedy and Trump. You can download the book for free right now by going to kennedy&trump.com. That's kennedy&trump.com. My name is Greg Fernandez Jr. God bless you all.
These are hard-working people like Robert F. Kennedy Jr. who came in. And he's going to help make America healthy again.
Are you supportive of these onesies?
Now we're talking about doing something.
Boxing champion Mike Tyson is teaming up with the Maha movement.
We're phasing out 8 common artificial food dyes.
He told us to fix it, and we are now fixing it.
Operation Stork Speed.
President Trump has directed me to find out what is causing the autism epidemic.
He is removing the CDC's recommendation for children and healthy pregnant women to get the COVID-19 vaccine.
Now we're talking about doing something. Doing something.
We've just signed 6 more waivers on SNAP.
The nation's biggest retailer embracing the Maha movement.
You're now seeing reforms that have been discussed for 35 years. Your drug costs will be plummeting downward. It's called Most Favored Nation.
These are massive wins for the American people.
My sister's name was Denise. She died of obesity at 25. She had a heart attack. I was so fat and nasty. I would eat anything. I was like 345 pounds. A quart of ice cream every hour. I had so much self-hate when I was like that. I just wanted to kill myself. We're the most powerful country in the world, and we have the most obese, fudgy people. Something has to be done about processed food in this country.